Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham. We're a team meeting to discuss everything healthcare. I'm your host, Shawn Needham, and I am streaming live from the Team Needham Abode podcast studio. And I am super excited to have our guest on today, Stacey Roberts. She's a physical therapist, RN, master's in nursing, actually, and going to be discussing menopause and joint pain. And as we wait for her to log in, I just want to discuss a little bit about menopause and joint pain. So there are, the hormones that are made up during in the ovaries, mostly progesterone, estrogen, estradiol, three different estrogens, but estradiol, estriol, estrone, and then testosterone. So all those hormones help to prevent joint pain. That's why you'll see many women that start having joint pain when their cycles become more irregular or when they are postmenopause and they don't have cycles anymore. So why is that? Well, let's go over testosterone first. So testosterone is a hormone that is normally associated with men. Fortunately, the education is getting out there now that women need testosterone and make up testosterone, just not as much as men. So testosterone is very important for things like increased muscle mass, decreased visceral fat, decreased depression, decreased cardiovascular risk, because it makes not only our striated muscle stronger, but it also makes our cardiovascular muscle stronger. Decreased dementia, it helps in our brain. So those are things that testosterone does, but more specifically to the joints, anytime, it's a feel-good hormone. So it's gonna, if you do have some kind of joint pain or some kind of inflammation, you're not gonna feel it like you would if you had testosterone deficiency. That is just normal. I've seen it many times where women post-menopause have knee pain, for instance, and they go on testosterone replacement therapy and their knee pain goes away. Now, did it actually fix the joint? Well, it possibly could. Testosterone is an anabolic hormone. What do I mean by anabolic? It means it helps build, we know that's why athletes abuse testosterone and take huge doses of it, PEDs or performance enhancing drugs, because it increases muscle mass. So we know it is anabolic to muscle, but it's also anabolic. Anabolic means instead of breaking down, it means building up. And it looks like Stacey's logging on right now. Stacey, welcome to our show.
Hi guys, so sorry, I was just finishing up with a patient.
That's okay. I was just chatting and getting started I was talking about testosterone and joint pain. So why don't you go ahead and introduce yourself and tell us about what you do.
Sounds good. So my name is Stacey Roberts. I'm a physical therapist of over 3 decades and also a registered nurse with master's degree and very close to being a nurse practitioner. I have a clinic in Milwaukee, Wisconsin, New You Health and Wellness, where we treat patients with orthopedic pain, including joints, pelvic health, and we also treat sexual health as well too. So my book, The Pain-Free Formula, comes out at the end of March, and that talks about all the different ways that we can treat joint pain without surgery, medications, or injections.
That is awesome. So tell us more specifically about joint pain and menopause.
Yep. So interestingly enough, we hear tons and tons of stuff about hot flashes and vaginal dryness and all those types of things during menopause. But if you look at some studies, it actually shows that joint pain is even more common than those things we hear all the time about during menopause. So many people come to me to be like, for some reason I started playing pickleball. My right elbow is fine that I play pickleball with, but my left elbow hurts, and now my knee hurts, and you would think it's maybe biomechanical, but then when you start talking to them about their history, it's usually that time of perimenopause and menopause that these kind of niggly joint pain and muscle pain start to surface, because for women, we don't have our estrogen, which is a nice natural anti-inflammatory when it's well balanced. And for men, outside of menopause, obviously, their testosterone does the same thing. So those hormones that are natural anti-inflammatories can be less and then contribute to more joint pain and inflammation.
So I was just discussing testosterone and joint pain post-menopause, and I've seen many women that go on testosterone replacement therapy, and their joint pain goes away.
Yep.
Now,
So
yeah, so I
that
think
makes
it could be multiple reasons. Not only does testosterone make us feel better, so we might not, um, might not feel as much pain because what it does in our brain, but
Mhm.
also, I mean, could it really repair, tendons and joints and muscles? I mean, it's an anabolic hormone. So can you speak on that?
Sure, absolutely. So we have to remember that testosterone in men stays, relatively high, but with testosterone in women converts to estrogen. Now, it converts to estrogen in both, but obviously in men they have higher testosterone levels, so that shouldn't convert as much into estrogen. But if a woman's taking testosterone, there's a good chance that that hormone cascade is also happening, where she's also getting a boost in her estrogen levels as well too. So what technically could be happening, and we don't know exactly for sure, but the theoretical part is that those hormones are anti-inflammatory. So we all have like a baseline or a threshold of inflammation in our body at any one time. We need inflammation in order to start the healing process. So all inflammation is not bad. Inflammation that hangs around in that pro-inflammatory phase, that really achy kind of phase where it's red, puffy, painful, that's the stuff we want to stay away from. But general inflammation, when you have pro-inflammatory moves to anti-inflammatory, the tissue can heal. That's a normal healing process. So when we, let's say our eating plan isn't the greatest, or been on medications and things like that, alcohol consumption, whatever would naturally increase inflammation to be, too much, we're also starting to lose our estrogen and testosterone levels at the same time, but we haven't changed the way that we're eating. And sometimes we even get a little bit worse, more alcohol consumption as we age, things like that. That then we don't have the protective mechanism against that, right? As much. We don't have that natural anti-inflammatory. So that inflammation can be either increasing, or our threshold to feel that inflammation more easily could be what's going on as well.
That makes total sense. Now, tell us about the benefits of estradiol or estrogen and joints. I've heard anecdotal reports where a woman has frozen shoulder,
Mm.
and then she goes on hormones, and probably on testosterone too, but estrogen has been linked to decreasing things like that. Can you speak on that?
Sure, absolutely. So something like a frozen shoulder, or again, joint pain, things like that are kind of coming out of nowhere, which often frozen shoulder happens after trauma, but even more often happens just for no apparent reason at all, but is common in perimenopause for women, and also with an autoimmune issue called Hashimoto's. We can
Mm.
see an increased level of the frozen shoulder. So again, it's kind of the same thing that, if we don't have enough estrogen in our body to help manage inflammation, then things like the capsule around joints. So the capsule is like a balloon around synovial joints that keeps the synovial fluid inside the joint. Synovial fluid is the good stuff that nourishes the joint, the kind of the lubrication to the joint. So like we have vaginal dryness, that joint fluid can kind of, I don't want to say dry up because it doesn't completely go away, but be less. And then the pliability of that joint capsule, which is usually nice and pliable when we have enough estrogen in the tissues. When we lose estrogen, we lose the elasticity of those tissues. So oftentimes why women get more plantar fasciitis than men, especially around that perimenopause and menopausal time frame, because that tissue would normally stretch and then go back, and then stretch and then go back. But during those times of menopause, if it stretches out in the plantar fascia in particular, it's not as elastic, so it doesn't snap back. And
Mm.
in the shoulder, it can stay more rigid and doesn't have that as much blood flow, or the ability for it to be as mobile. And so that capsule kind of locks down on the joint, and we can't move it as much. So estrogen helps the pliability of those tissues.
And we do know that estrogen helps stimulate collagen production. So
Correct. Hmm.
I would assume that that's going to really help with joints, right?
Absolutely. Yep. We don't know. I wouldn't say that we could very clearly say to take estrogen and it's going to repair a ligament, right? That's damaged. But could it improve the body's ability to repair that to a certain degree? So, like, for example, we use a technology called soft wave therapy in our clinic, which is a type of shockwave therapy that significantly increases blood supply to the area. While it's increasing blood supply to the area, it's helping to replace some of the things that due to hormone changes, our body is naturally missing. So we can then, like a frozen shoulder, if somebody gets stuck in physical therapy with a frozen shoulder, I do soft wave for 2 or 3 times and their shoulder's moving again, right? So we're improving that by bringing more blood to the area, but also modulating inflammation in that localized area to help improve the health of the joint and also the ligaments and tendons and anything else that might be involved, even the muscles.
Well, and I think our bodies, and that's why I love talking to physical therapists, because I learned so much. Being a pharmacist, I learned drug therapy, and that's my expertise. And for people that follow us, they know that my wife and I both, we don't believe in drugs to treat most long-term problems.
Right.
And that includes most long-term joint problems.
Mm-hmm.
I mean, NSAIDs are not the answer long-term. If you're having, a problem with your knee, you need to address that problem.
Yeah.
And,
Interesting.
you give the body the right inputs, like you were kind of talking about. I mean, not only hormones, but also, movement. And that's one thing that the physical therapist helps with. And you eat right. You sleep, your body recovers, and these things get better, but you've got to do the right things. There's no magic drug necessarily that's going to fix this stuff, right?
Yeah, exactly. And NSAIDs, which is, NSAIDs, pain meds, the longer you take them, the more they actually make you hypersensitive to pain, right? So the research is showing that even taking NSAIDs at times for short term can lead you to being more likely to develop chronic pain. So we often are conditioned to take these things, as a quick fix. I'll never forget a bus ride that I was on. I used to live in Australia, and I was flying home to the US, and we all were going from the international terminal to the domestic terminal, and everybody was tired, and it was a crowded bus. And this mom and her son were sitting across from me, and he had her hand on her, he had his head on her shoulder and was just tired. And he's like, "Mom, my head hurts." And so she dug in her purse, and she's like, getting a pill out to give to him. And he's like, "No, I don't want to take it." And he pushed her hand away, and she, put it in front of him again, "Take this." And he pushed her hand away, and she's like, "Take it." She's really, everybody's really tired. Now, me, if that was my parents, well, we probably wouldn't have been flying, internationally, but because we came from a very modest background, but they would have said, "Get some water, eat a banana, go outside and play, do whatever," versus, saying, "Here's a pill to fix it." So that was probably 15 years ago. So it really made me realize the big shift towards quick fix, take a pill, and then what are we teaching our kids to do at that point in time?
And especially something that's so temporary. And I apologize to anybody that's watching that has, migraines
Right.
long term.
Different story.
I mean, let's face it, Stacey, we've all probably had a headache at one time in our lives.
Right.
We don't really need to treat it with a drug.
Right.
And they've shown over and over, and I know this from a pharmacy standpoint, that you get rebound headaches when you rely on too many drugs. Not all drugs work that way, but a lot of them do. And I think there's just a lot of, kind of what maybe you were getting into, there's a lot of psychological part to it too, that if we just reach to a pill for every quick fix, then we're not going to do what our body needs, which is necessary to respond appropriately and adapt appropriately.
Right, exactly. And, a lot of the pills, not all, but a lot of the pills are stopping processes from happening. And that's why they have side effects. Hormones are, as you know, are a little bit different in that they, help the body do what it's supposed to do. To a certain degree, you can get feedback inhibition, and you slow down the body's production of that hormone if it's not being monitored or you're taking too much of it or whatever. But the hormones work a little different than other medications. But supplements, if they're a good quality supplement, give your body what it needs to allow itself to nudge itself in the right direction to heal. Right. So it at the right dosages, it's not suppressing things and causing other side effects at the appropriate dosages.
Right. And I always like to say, and I'm sure you believe this, that, supplements are just that. They're just supplement a good lifestyle already. You can't supplement your way out of a bad diet, or, you can't drink alcohol in excess all the time and expect to supplement your way out of it.
Exactly. You can't go to McDonald's every week and expect your supplements to make up for it.
Right. No,
Right.
that's just not the way it works, right?
Exactly. Yeah.
Yeah.
And, if we're on medications long term, like you mentioned, migraine headaches, and I've just seen a patient earlier today who has osteopenia leading into osteoporosis, but she's been on asthma medications for, 20 years. So
There you go.
corticosteroids, which can then deplete her body of certain nutrients, leading her to develop other issues. So the knock-on effect of that is, what are you doing in your diet? Because this is going to create, issues longer. And she doesn't eat vegetables, right? She's very little fruit, and she's realizing that this stuff is kind of, catching up with her. And then you add in the long-term use of the corticosteroids. That's just a perfect storm for, developing things like osteoporosis. So you can try to work around that by, main thing is what you're eating as far as your food, and then, like you said, just supplement to that good eating plan to help your body, address some of those areas.
Right. And I don't think a lot of people realize, while we're on that subject, I don't think a lot of people realize that asthma is largely an autoimmune disease, and it is affected by your diet.
Yeah,
And I have
vitamin D
seen,
deficiency is huge in asthma-related symptoms, and sometimes instead of putting somebody on a corticosteroid, if we just check their vitamin D and trial them at least on vitamin D if they're low or deficient to see if that helps. I mean, obviously there's emergency situations that are different than that, but we always unfortunately go to that quick fix instead of
right,
thinking, what's the underlying issue that we can do to avoid having to take these medications for life.
yeah, I mean, it's like, why do you have asthma? Why has
Right.
asthma increased over the last 30 years?
Mhm.
Um, I mean, is there a food? What is going on? Is there a lifestyle? It's probably a combination of a lot of things, actually.
Absolutely, absolutely.
But it doesn't mean it's not reversible. And I've seen people reverse their asthma. And I've had horrible, when I was a kid, I had horrible hay fever when I was a kid.
Mhm.
And even up into an adult when I was still eating crappy. But when I changed my diet, I hardly ever have an episode of hay fever anymore.
Yeah,
It's very, very rare. And I
yeah,
think it's largely because I changed my lifestyle.
I'm sure, and we feed our gut what it needs, then that's gonna help with our immune system and
Right.
supporting our immune system, supporting our absorption of nutrients into our system. So the gut is really important, and in my book, I talk about the gut joint axis because nobody really understands that your gut can affect your joints. So newer research is showing that if your gut isn't as healthy as it could be and you have leaky gut or increased intestinal permeability, there's a type of something that's attached to the bacteria, a gram-negative bacteria that gets into the tissue and can settle in the joints and actually create some of the degeneration. So instead of only wear and tear, we're now seeing connections between the gut starting to break down the byproducts of the gut getting into the system that shouldn't be there. It shouldn't be there at a high level. Could actually be contributing to degeneration of the joints. So by fixing our gut, we can also decrease inflammation overall. As you know, the gut helps to metabolize our hormones, right? So giving the gut what it needs to help with that process as well significantly impacts just overall excessive inflammation in the body, getting it back down to more manageable levels.
Well, I know as a functional medicine practitioner, we say this all the time, and people probably get tired of hearing it, so I don't even like saying it, but the gut is everything.
Hmm.
And really, when you think about it, we shouldn't be surprised.
Right.
Um, all of our nutrients, not all, but most of our nutrients that we absorb on a day-to-day to sustain ourselves comes from our gut. So
Right.
if we don't have a healthy gut to absorb the nutrients that are appropriate to maintain our immune system, to maintain our general health, it's going to be a big problem.
Hmm. Absolutely. And I see people who tell me I eat really well. I'm really, I'm good. I really pay attention to what I eat, but I still have these issues. How can it be my gut? Well, a couple things. Maybe you didn't always eat really well, and we got to do some things to optimize the gut because of what you did prior to eating well. And then I even see patients who have food sensitivities to things that seem to be healthy, but they actually can be, if they're reacting to them, even if they're healthy, that can create more inflammation and then contribute to joint pain as well too. So we do food sensitivity testing to see, which foods they may be sensitive to that we might have to eliminate for a little bit of time, and see if that helps with the joints also improving. So our soft wave and our physical therapy work on the biomechanics and the localized inflammation. But if people aren't getting better, we start to look at the gut. We start looking at what foods that they're eating, food sensitivities, hormones, stress, all those things that can create systemic inflammation. So we can calm down systemic inflammation, then the localized inflammation will decrease as well.
Yeah, that's absolutely true. And I think people need to realize too that it's not a quick fix. It takes time.
It does.
Usually their gut didn't get out of balance
Right.
overnight.
Exactly.
So you can't fix it overnight. It takes months. It really does.
Yeah, it really does. And they often don't realize that even if you don't have any of the typical gut issues like constipation or diarrhea, that doesn't mean that your gut's perfect, right? Everybody always says to me, I say, do you have any flatulence? And they're just like, oh yeah, normal flatulence. I'm like, so what does normal flatulence mean? Is that they're like, oh yeah, I mean, a couple times a day, 3 or 4 times. So you can have no flatulence. And they're like, what? Yeah, you can have no flatulence or very, very occasional flatulence. So, but even some people without any digestive issues, so non-celiac gluten sensitivity, right? You can have no gut issues whatsoever, but maybe your joints are hurting. Maybe you have eczema or psoriasis. Maybe your hair is falling out. Maybe you have fatigue or brain fog. That could also be directly related to the gut, even if you don't have, significant digestive issues.
Yeah, absolutely. Everything's related to the gut. It really comes back to that. Yeah.
Yeah.
So go ahead.
I was going to say, then the more they dig into that research, the more connections they see.
Yeah, for sure. And then, like I said, it just makes sense. Our gut is everything. It's meant to keep us alive. Without it, we can't get our nutrients to have a healthy body. So,
right.
Tell us a story that you have. I'm going to put you on the spot, and tell us a success story that you have of a menopausal person that was in joint pain, had joint pain, and you helped them overcome that.
Sure. So, there's several to choose from. So, for example, there was a patient who came to see me with significant knee pain. The last thing to do was to have a total knee replacement. She wanted to avoid that as much as possible, and she came into the clinic and we did our soft wave therapy, which works amazingly well with localized inflammation. But if it doesn't, like by the second or third treatment, she was coming back and saying, it feels pretty good for like 4 or 5 days, and then it goes right back to where it was. And then it feels good, and then it goes right back to where it was. So it's kind of like we're dumping out the inflammation, and then the body's filling it back up. So what we did is we took a look at her eating plan. She was perimenopausal. Her periods were irregular. We took a look at her eating plan, and she was also pre-diabetic. And we said, okay, what are you having more that could be contributing? So gluten was a big issue for her in her diet, also sugar with the pre-diabetic issue. So we started working on her eating plan. I said, okay, just want you to give up just gluten for right now. Let's see how it goes over these next 3 or 4 weeks. So she was actually going to Disney World with her daughter. She gradually got better. And she's going to Disney World, and she's going to be walking all over. The food's going to be terrible, all that type of stuff. And I was petrified that she'd flare everything up and go backwards from where we were at. So she went to Disney World. We did a couple more soft wave sessions before she went, and we, had her tape herself up and wear the right shoes and do everything that should to decrease the inflammation in that localized area. But I was even like to myself thinking, we're just going to go backwards because of all this stuff going on. Well, 5 weeks later, she came to see me for kind of some maintenance sessions, and she came in and sat down, and I was nervous. I was like, how did it go? I was worried that she didn't come back because she was, not happy, didn't think it, didn't go well. So she sat down, she looked at me, and she had this really stern look, and I was, just worried. And then all of a sudden the smile came across her face. I said, how did it feel? She's like, I didn't have any pain. She's like, I brought all my food with me. We didn't eat any of the crappy food in the park. It was a little bit more of a pain because we had to walk to the car, but it was great because we saved some money doing that. She said, I wore the right shoes. I wore the sleeve that you gave me and taped everything up. And she said, my daughter and I had the best time of our life at Disney World. And that was just, to me, it just showed that her knee was full of arthritis. There's no doubt about it. She's going to have a knee replacement, but that doesn't mean that just because you have arthritis that you're doomed to have significant pain and have to have surgery. Now, there certainly are some people that need surgery, and I refer people to get surgery if they're not doing well, but I think that's too quickly the first thing that's done instead of the last thing that's done. Now think about how empowered she is to be able to take care of that. Not only that, the knee pain was gone, but she was no longer pre-diabetic after making the changes in her diet. So that's pretty cool.
And of course, there's so much research to show how inflammatory excess sugar is in our body.
Oh, yeah.
So we shouldn't be that surprised.
Exactly.
And one of the problems I see with this is that so many people, because they get sent to a surgeon, and what happens when you get sent to a surgeon? You need surgery. I mean, that's what they say, right? So, but her problem wouldn't have been fixed with a new knee. That new knee would have worn out again. It just, it would have given her some more time. But unless you fix what's causing all the inflammation, you're just going to keep have to have surgeries. In fact, I interviewed Shawn Baker on our podcast one time. Dr. Shawn Baker, author of The Carnivore Diet. Have you heard of him?
Yes, definitely.
Yeah. And he's an orthopedic surgeon by training. And when I interviewed him the first time, it's been over 5 years ago. I've interviewed him twice, but I asked him a serious question, and I was surprised to get the answer. As a pharmacist, I understand that over 80% of all medication that is taken it would not be necessary if people change their lifestyles. That's just a fact, right?
Yeah.
So I asked him as an orthopedic surgeon, how many surgeries what percentage of surgeries are done because people won't change their lifestyle?
Oh, interesting.
And I was astonished by the number. 70%. He said that 70% of surgeries could be prevented if people change their lifestyle. And he knew that. Partly, that's one of the reasons he got in trouble as an orthopedic surgeon, because he wasn't doing enough surgeries.
Right.
Because he changed his patients over to a keto diet. Then all of a sudden the numbers go down. So the hospital, files a charge against his license, and he has to fight for. And now he's doing much better and helping people instead of just cutting people up. And I'm sure he feels a lot better about that. But
absolutely,
but it's just it was unbelievable to me. And it's just a reminder that most things we do, our bodies will heal themselves if we give the right input.
Yeah, exactly. And now what I've seen in my career is, when I came out of school in 1990, you rarely saw a person that had a knee replacement who was younger than 65. Rarely, ever.
Yeah, right.
But then progressing over time, they started to do research on, joint cleanouts, like to do arthroscopic surgery to take care of your meniscus issue or whatever. And they found that when they just did a sham surgery versus the active surgery, that more people in the sham, meaning they didn't get the intervention, but they thought they did because they drilled a couple holes in their skin, but they actually didn't get the intervention. The sham surgery actually did better than the people who had the meniscal repair or the clean out, right? So they've really turned away from doing those surgeries. But what's happened as a result is the age now is younger and younger of people having total knee replacements. So instead of the arthroscopic surgery where they poke a couple holes and try to do the repair, now it's much more significant for people in their 40s, even 40s, less common, but 50s, of having total knee replacements, total joint replacements. And guess what's gone up as a result? Well, the total knee and total hip replacement complications and infections have gone up significantly. But again, there's research now, and I hate to beat the drum again, but there's research about if the gut isn't as healthy as possible, then these people can have infection, they can have issues after the surgery. And it's no wonder that they were losing money from not doing the arthroscopic surgeries. They had to find something else to do. And now there's no placebo or sham studies to see, do we really need those total joint replacements, right? Are those going to fare better than a sham surgery to say that, hey, you may or may not have had a total joint replacement. Let's see how you do over these next couple of years. And then it'd be really interesting to see if the placebo or sham surgeries actually had equal or even better results than the actual surgery itself, like they've seen in other surgeries.
And again, if you're not fixing what's causing inflammation of the joint, then,
Exactly.
you know, and I could see, you know, it could be an acute accident, like a
Sure.
trauma or something like that. And
Sure.
that's what surgeries that's what used to, most surgeries were from acute trauma,
Mm-hmm.
you know, but now they're not. It's from people that are carrying around too much inflammation, carrying around too much weight, and all of a sudden they need new knees. And
Yeah.
isn't it a fact that on a good knee replacement, you can't get more than 20 years out of them? Is that a fact?
It depends on the person and the type that they have done, but it's extended from like the 10 or 15 years to potentially 20. But I question that sometimes too. And the revisions, like the surgeries that fail and they have to redo them. My mom was a particular example of this too. That she had a knee replacement because she had terrible arthritis, terrible pain. Of course, when she, improved her diet a little bit and didn't drink as much wine, the pain was better. But, she wanted to, have her wine and do all that other stuff. And so she ended up having a knee replacement, got a reaction to the metal in the knee replacement. They didn't believe her that she had a reaction to the metal until 2 years later. Her whole body broke out and skin rashes. So they finally decided, okay, maybe this is an issue. So she had 2 revisions on her knee, and she still had problems with it afterwards. And why is that? If we're not treating the underlying cause of that issue, the surgery is not going to make it go away. And that we see that in back surgeries all the time. We've seen that for decades.
And if you're getting surgery in your 40s, that means, if it does last for 20 years, you're going to need another one in your 60s.
Right.
And then if you live to be 80, you're going to need another one.
Mm-hmm.
And it's just, I would not want to repeat that cycle.
Right. Exactly. Now, again, there are some people that absolutely need it, right?
Absolutely.
But I think the amount, like you said, that's unnecessary, especially because other things haven't been done to address the probable underlying causes, is just astronomical these days.
Yeah, I totally agree.
Mm-hmm.
Stacey, tell us a little bit about your website here. I'm going to stream your website. Tell us a little bit about your website if anybody has any questions.
Sure. So New You Health and Wellness is the clinic that we have in Milwaukee, Wisconsin. We do a lot with chronic and acute muscle and joint pain. We also do functional medicine. So like I said, if you're coming to see me and the localized things that we're doing, the biomechanics that we're teaching you how to change, how to move, isn't resolving your pain, then we move you into our functional medicine program to help look at the hormones that we talked about. We help look at gut health. We help look at stress levels, food sensitivities, to try to pinpoint why the body isn't able to get rid of that localized inflammation. So, and we use soft wave therapy because I've seen that decrease the number of treatments people need from, 12, 14, 20 PT treatments down to 3 to 6 treatments. It accelerates the healing much more quickly in that localized area. So we use those things, the more advanced technology, more specific soft tissue mobilization, lots of manual therapy and functional exercise. And then we do testing to see, like I said, if the person's not progressing, why not? So now let's find the underlying cause. If those I call them tangible triggers of the pain, and if we address those and that's not resolving it, let's look at the intangible triggers and try to address those.
Awesome. Well, you've helped us realize our goal, Stacey, which is to educate and empower individuals to take charge of their own health. So I appreciate you being on and sharing your knowledge and wisdom today.
And thank you so much for having me again. Sorry, I was running a little late with my patient. I apologize about that.
No worries whatsoever. We didn't miss a beat. It was awesome to have you here. So thank you so much. And thank you, listeners and viewers, for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Thursday to our midweek scheduled podcast, 8 a.m. to 9 a.m. Pacific Standard Time. Thank you for tuning in.